Yeah, what are your thoughts on clinic during the transition?
Changes? Really? Wow, no one told me about them. I didn't realize all the faculty changes that were occurring. 10, 15 years we've been up at Trident, we really haven't had much transition. So I guess the law of averages finally caught up to us.
Really don't have enough experience to tell how it's been going yet. I've just been here a couple times precepting, so I'd have to give it more time to see how it's going.
It's working so well. I'm envious how HCA could manage it to perfection.
Well, I really like the lack of all support staff myself, and I really feel that winging it every day in every clinic is really exciting. You never know what you're going to get.
No, I will not. Okay. My head hurts too much. Well, I broke the refrigerator. That's the answer. Life gets better?
You know, I think it's wonderful. It's awesome, and I think the new clinic transition and the electronic medical record are just fantastic.
Confused, apprehensive.
Change is always difficult, so I think this has been difficult as well, especially with me having problems signing in the charts today.
Well, I hope you guys are cleaning this stuff up.
So what are you going to miss the most about our class?
Yeah, turn the camera off once. Let me think of something. Or you still gotta go. Let me come back to that one. I'll think about it.
I'm trying to. But there's certain things I don't want to say. I mean, I've got certain things that aren't very complimentary, but this isn't the time to talk about it.
Maybe I don't know, I better defer that question to somebody else.
Wow, what am I going to miss the most about that? Well, being able to sleep while I was on call, because I never got a call before 9 p.m. There was a courtesy call, and then maybe at 6 a.m. Oh, by the way, there were 3 or 4 ICU admits. I'm going to miss the sleep.
Next question, please.
Okay, I was just wondering, who was easier to train, residents or your dogs?
Dixie and Abby.
So is it true that Mike, Heidi, Nikki, and Luke are coming back?
I think we're doing the wrong thing. Let me think about it.
Next question.
What is this? What are you doing?
You know, residents become faculty, they just never grow up.
Oy.
Hey, so Dr. Carrick, what did you think when Ryan wanted to have all the third years get the day after graduation off?
Listen here, girlfriend. You can't do that.
Hey, but Dr. Brock, why do you think the residents were so adamant about getting the day off after graduation?
Recognize a possible underlying cause for this inconsolable behavior. One possibility is that they've been molested. Is that you ask? So what was your childhood like? Were you safe? And it's not uncommon that they'll tell you that they weren't safe. And it's also not that uncommon to find them say, nobody's ever asked me this before.
Dr. Brock, there are 8 graduating residents in our class. Can you name them all?
Are you doing a mini mental status? Yeah, I think I can. You won't know. I'm not going to take a chance and then find myself leaving out a person. No, but I think I can. You, obviously, and if I'm not mistaken, you. I'm not going for honors. I just want to pass this test. Giving me performance anxiety. No, now I've got a block. Total block.
You know, I get mixed up with the second and third years and all that stuff. I want to make a fool of myself.
Yes, but I wouldn't cheapen our relationship by going there. You know I know every one of you. I might mistake some of you for a second year versus a third year, but early senility is a tough thing to deal with, so just forgive me and go with it.
Dr. Bennett, can you help him out?
No. Let's see. There's this Simonac guy. Labstain, but I had cheat sheets for this one. I mean, honestly, I don't know if that really counts. There's West. There's Peterson. There's Bush. Carr. Babsar doesn't count. She's a fourth year. How many people do I have left? I know all of you.
Tiffany. Who else? I should be good. 4. I haven't been here for a year, so I think I should be able to get away with 4. Let's see. Emily, Kristen, Harvey, Jennifer.
We had an Englishman who was a nutritionist. We had a huge...
So what are your fondest memories about the class of 2012?
You make me uncomfortable. Goodbye. So, another question, please.
I wouldn't know, officer.
Whatever the ACG requirements are.
That they make you laugh. A lot of the times the things they say and the things they do.
You know, I like to see the resident strive towards doing the right things right. I don't expect somebody to be able to do it all the time. None of us does. But strive, recognize that that's what you're striving for. So I like to see somebody who knows his stuff, is connected, asks the right questions, and can engage the patient as a person and see the whole picture. That really is very exciting.
What advice and parting words would you say to the transitionals who are leaving?
Well, the transitionals, I'd say, I hope that what you've learned in your stay with us is the fundamentals of our discipline, which is informed by an understanding of the doctor-patient relationship, an understanding of clinical epidemiology, an understanding of population-based community responsive care.
I think this has been a very good year for the TY program. I mean, the normal bumps along the way, but hey, we're human beings learning how to be docs. But it's been a very good class, so I wish them all well.
Do you have any advice for us graduating third years?
Think fabulous and life will be fabulous. Be yourself and feel beautiful every day.
Work hard, always be honest, always be your patient's advocates. Remember that you don't work for a health system, you don't work for a partner, you work for your patients. And make sure you always do what's in your patient's best interest.
You have more free time and enjoy the last few days while you're here. So, with whatever you're doing.
Very good.
You will miss it. Even though you may not think you will, you'll miss it.
Be yourself and keep the faith. Well, basically, you should try to emulate me. Do everything that I've done, and you will be a great success in the future.
Medicine is not about money. It's about taking care of people. And there's a lot of pressure to see people in a short period of time and code, but it's really still a sacred relationship between a patient and a doctor, and so you've got to advocate for how you think medicine ought to be practiced, but within the rules. I mean, it really is a very important calling, and you got to do it in a financially responsible way and by the rules, but you can push back and do what's right for your patients.
I'd say keep up the good work and never close door to any opportunities that might come your way, and good luck to everybody.
Hey, party less, work hard, and try to be patient.
Retain your passion for what you're doing. That's much more important than what you earn. The money will always ensue, but follow your passion. Don't work for money. Because the money won't compensate for the hard work. It never does, not in medicine. And if you're passionate, you'll earn a good living. Feeling privileged to have a front row seat in the lives of your patients. You're a very privileged observer, and take that role seriously.
Go forth and conquer. Really make the best of it. Your practice is what you make of it.